Welcome to the Missouri Pharmacy Podcast, where we discuss the important issues impacting one of the most trusted professions in healthcare. From the opioid epidemic to opportunities in the profession of pharmacy, we discuss the issues pharmacists want to hear about.
Obviously, the Missouri Pharmacy Association plays several roles on behalf of our members. One is our defensive stance. We spend a lot of time in the Capitol trying to make sure that bad things don't happen to our members and working on issues to try to expand opportunities for pharmacists and try to make some changes to the way that third parties, the insurance companies, and pharmacy benefit managers treat our members. But the second side, one of the more enjoyable pieces is looking at ways that we can expand the practice of pharmacy. Again, I think pharmacists showed their value over the last few years through the pandemic and some of the activities that they were involved with on behalf of patients and their communities when they saw other healthcare facilities closing down. So we spend a lot of time looking at ways, how can we expand opportunities for pharmacists within their training? What we want to do is make sure that pharmacists can practice to the fullest extent of their license, working very closely with other healthcare components, physicians, and others within the community to make sure that patients are getting the activities and the services that they need. And we do that through a number of ways. We have an organization we've been involved with. It's a national organization. We monitor the Missouri chapter of it. It's a Community Pharmacy Enhanced Service Network, or CPESN, and they are looking at a number of ways of trying to help local pharmacists be able to provide services and be able to be reimbursed for those services. So working with insurance companies on opportunities, again, working within the framework of other healthcare providers, and we're looking at a whole host of opportunities through CPSN. We also work very closely with the Board of Pharmacy in looking at what's going on in other states. What are things that we could bring to the state of Missouri that, again, would enable pharmacists to expand their practice, provide additional services to patients, complement services that the patients are receiving from their physicians and from other healthcare providers, but yet being able to do it on almost a demand basis. I mean, most of us understand that you can walk into your pharmacy and within a few minutes you're talking to your pharmacist. Obviously, if it's something more intense, it's probably going to be done on an appointment basis, but you have the availability to talk to a healthcare professional very quickly. So we're working with the Board of Pharmacy and, again, looking at opportunities. How can we expand the services that they provide to their community? We've been very fortunate at the Missouri Pharmacy Association. We have a service corporation that is able to provide some funding for us. So we've been able to fund a couple positions. One is an executive fellow that we bring in. It's a one-year placement. Students that are graduating apply for the opportunity. They spend a year with us. And most of their activities are focused on, again, some of our expanded, either through our grant programs or activities that we're working with the Board of Pharmacy on, but they get to spend hands-on a year working with us in the Capitol and in other places, attending Board of Pharmacy meetings, attending other national meetings where they can pick up ideas on how can we expand this practice. And then the second way that the organization has been able to help us, they provide funding for a pharmacy leadership program. And we will typically bring in 15 to 20 young pharmacists, typically young pharmacists, leaders in the state of Missouri, to give them some background on leadership training and how they can be a better resource, not only to their profession, but to their community as they go back home. We've had many of our board of directors and other individuals in the practice of pharmacy in the state of Missouri that have come out of that program. So we put a lot of emphasis into trying to develop the future leaders, and then they get excited about things that we're doing here at the Pharmacy Association and want to participate in committees. And again, many have moved their way onto the board of directors. And then the final thing I'd talk about is we serve as a coordinating agency for a handful of grants, some of them coming from the CDC on the federal level, but through the Department of Health and Senior Services here in the state of Missouri. And again, most of those are pharmacy enhancement activities. We're working very closely with the state of Missouri, especially coming out of the COVID pandemic, on getting more pharmacists involved in vaccinations and being a resource within their community. We've got grants that cover a whole host of activities. We're able to get into our pharmacies, work with them, reimburse them for their times. What we're trying to do is create incubators of services that we can then scale across the entire pharmacy perspective in the state of Missouri. So the grant opportunities, again, provided either through CDC or through state opportunities, give us resources that we can train and bring pharmacists up to speed on some new opportunities in their community. So these things, the Pharmacy Association, again, that's kind of the fun part of what we do, trying to expand the practice. We've got a staff that's dedicated to that. We've got pharmacists on staff working on those programs. Again, the executive fellow. We're also a site where students can come in and spend a month on their rotation schedule, their last year of pharmacy school. So we feel like we've got a lot of different resources in-house to be able to help us generate those programs. So we're really excited about what's going on in the state of Missouri, and I hope our members are too.